If I had to point to one thing, I would say, in recent years, one place that I've learned a lot of really valuable communication skills is from the time that I spent on palliative care services. Sometimes it may sound kind of like trite, or people may kind of downplay thinking intentionally about how we communicate, but I have found it to be incredibly valuable to have conversations about how is the way that we're communicating saying things that aren't in the words that we're saying, and how do we be more mindful about the way we communicate, and can the way we communicate change the interactions we're having with people. For example, two things can be true at once. When we're navigating a conversation with a patient or their family about, say, like end of life type of things, and maybe the patient or their family says, well, I hope that my loved one recovers and makes a full recovery. But from the medical standpoint, we feel that that's unlikely to happen. It's tempting to say, well, I hope that too, but I think this is what's going to happen. And that but becomes oppositional and kind of downplays the hope that the family is looking for. But two things can be true. We can also hope that the patient makes a recovery while also feeling that that may be unlikely. And so instead of saying, but, we can say, I hope that your loved one makes a recovery too. And I worry that that might not be what's most likely. And the phrasing to say and instead of but, I think can go a long way. That it breaks down the walls of being oppositional, while also being able to communicate whatever it is, the information that you need to get across.